Health Minister Dr. Christopher Tufton has responded to concerns about decreased testing and contact tracing for COVID-19. The matter was raised at the Joint Select Committee meeting on the COVID-19 pandemic. Shamela Pullen reports.
Recently, the country has seen a reduction in the number of new COVID-19 cases, raising renewed concerns about testing and contact tracing. At Wednesday's Joint Select Committee on the COVID-19 pandemic, Health Minister Dr. Christopher Tufton reasoned testing is no longer crucial at this point because it will only give an indication of the challenge, which is already obvious. He also argued that clinicians have long explained that contact tracing would at some point become impractical.
And because that's the way the statistical modeling works. And I think the CMO is correct in advancing that. So I do agree that there's a level at which you should not go below, but there are optimal levels and there are levels at which diminishing return sets in, unless your objective is to test to determine infection as opposed to prevention of the infection.
But opposition spokesman on health, Dr. Maurice Guy, who is among those raising concerns, was not in agreement.
And I think that if that is the information that you want to give to the populace out there, then you should couch it in the language that it is because of this, that, and the other, why it is so. But to say that those long-standing public health measures are really counterproductive and that they have diminishing returns, I think it's an unfortunate statement.
The health minister was strident in his view that the solution to the COVID-19 virus spread does not lie in testing.
It is observing the protocols that we currently have announced, the wearing of the mask, the physical distancing, the sanitizing. It is in the vaccines which we are placing great hope so that one's immunity can be built up. And there are several other things that are necessary. Testing is to give us an indication of the extent of the virus in the population. And statistically, there comes a point when testing everyone is not going to tell us a lot more about what is happening. And I maintain that position.
Currently, there are more than 20,000 active cases in the country. Shamela Pullen, TVJ News.